Hello, everyone. In this podcast, we will be discussing sensitive topics such as sexual assault. It's important to take care of yourself while listening. Some suggestions are listening while you're in a healthy headspace or knowing who you can reach out to if you become upset. Our 24/7 helpline for crisis calls based out of Central Florida is 407-500-HEAL. By contacting the National Hotline at 1-800-656-4673, you can get support and learn about your local resources. There's always someone ready to help. Welcome to the Victim Service Center podcast. Here we sit down with professionals that serve survivors and victims of trauma or those who've experienced violence and have conversations about social issues. This week, we are talking about TF-CBT. My name is Emilie Mitchell. My pronouns are she, her, and I am the education coordinator at the Victim Service Center of Central Florida. With me today, I have Dr. Rachel Kim. Dr. Kim uses she, her pronouns and is a clinical psychologist and the director of implementation at the Baker Center for Children and Families. Her work focuses on the dissemination and implementation of evidence-based practices, or EBPs, for underserved youth in community settings. So Dr. Kim, thank you so much for being here today.
Thank you so much for inviting me. I'm so excited to talk about this really awesome and important topic.
I'm really excited too. And I also have returning JoEllen Revell, probably for the millionth time. So JoEllen uses she, her pronouns and is the Victim Service Center program director who oversees the advocacy, therapy, and forensic nursing department. She is a licensed clinical social worker with over 20 years of experience in clinical and administrative oversight. So JoEllen, thank you as always for coming back onto the podcast.
It's always a pleasure. I am very happy to be here with Dr. Kim.
Me too. I'm really excited. And just for a very brief introduction, at the Victim Service Center, the VSC, we have incredible crisis counselors and therapists that utilize specific types of therapies that are specifically designed to help survivors of trauma. So among those include EMDR, or eye movement desensitization and reprocessing, DBT, or dialectical and behavioral therapy. And today we will be chatting about a new therapeutic approach at the VSC, TF-CBT, or trauma-focused cognitive behavioral therapy. So we will be discussing what this can look like, who can benefit from this approach, and the importance of community partners and support systems when it comes to healing. So with that, I think it would be really helpful to define some terms and lay some groundwork as to why we are doing this podcast to just start off. So what is CBT? What is cognitive behavioral therapy?
Cognitive behavioral therapy is an evidence-based approach to treatment for a whole range of different mental health challenges, anxiety, depression, and trauma. It's a pretty, at this point, it's a pretty general approach, with the idea being that the way we interpret situations, the way we think about them, impacts how we feel, and our thoughts and our feelings then impact our actions, how we choose to react to certain situations. And so within CBT, we're helping people identify more helpful or adaptive ways to think about problems or challenges they're facing, to help address how they're feeling. So maybe they need to use some relaxation strategies to reduce some of that really kind of intense tension they might be feeling when they're having a hard time, and also come up with more adaptive or helpful ways to act in different situations. So maybe instead of avoiding something that's making you uncomfortable, you're actually facing it in a way that is true to you, but brave. So we're really trying to help engage people in that whole process of changing how we think, addressing how we feel, and then choosing helpful actions.
I mean, really, when you think about the helping professionals, counseling, CBT is kind of like the foundation. It's like the first line of defense with trauma. And professionals learn it because, that constellation of thoughts, feelings, behaviors, what does that mean? What does that look like? And many times, if you have a client and they have their counselor who has a good therapeutic rapport with them, they can really make an impact on getting their clients to understand, what happened to them was truly a trauma. And those thoughts, feelings, and behaviors or reactions, sometimes I use that phrase, make sense in the moment and are changeable. They're not stuck. So that's super important because many people who face traumas really sometimes do believe that they are stuck in that.
Yeah. And it's like part of what's great about any kind of cognitive behavioral approach is that it's skills-based. We're really helping empower people to take some more control in their lives, which I think that especially for people who have gone through trauma, they feel like they've lost control and they feel like their life is out of their hands. And so to be able to give them some skills so that they can feel like they're in the driver's seat is exactly what we want to be doing for those folks.
I think that that's such an important point, Dr. Kim. And JoEllen, what you were saying as far as recognizing that there isn't anything wrong with this individual either, that these are very normal responses to what happened to them. And then also giving them the skills and tools to take charge, like you were saying, Dr. Kim, is incredible as well. So with that, we are talking specifically today about trauma-focused cognitive behavioral therapy. So what is TF-CBT and what are the key differences between this and CBT?
Yeah, so TF-CBT is, like it says in the name, another more specialized approach to treating children who have gone through trauma and are exhibiting symptoms of post-traumatic stress. It's basically got some much more structured skills that are designed specifically to help kids who have gone through trauma. So one of the key differences is that there is this piece of post-traumatic stress where people are re-experiencing the trauma, basically. So they're really being struck by the flashbacks, the memories. For children, it comes out a lot as nightmares of the trauma or kind of similarly related scary situations. And so when they're having those re-experiencing symptoms, basically they're being then flooded with lots of emotions and negative emotions, and also of really unhelpful thoughts that are no fault of their own. And so what trauma-focused CBT does is that it has some skills components that are specifically to address some of the uncomfortable body feelings that people have when they're re-experiencing some of the trauma memories, so that we're teaching kids relaxation skills to help manage some of the physical symptoms. We're also teaching them some emotion coping strategies to help identify different kinds of mood, and then to be able to use different skills to address that. We're helping them identify when they're having unhelpful thoughts. So there's a lot of feelings of guilt and blame, or thoughts of guilt and blame for these kids. And so we're helping them to restructure those or reframe those, because by and large, kids are not guilty of the trauma that, for many of these children, they've been victimized by other people. So we're helping them rethink those thoughts that are not helping them and that are contributing to increased negative mood. And then the most, I think, powerful and effective component of TF-CBT is what we call the trauma narrative. The idea behind this is that those memories keep coming up, and they are uncontrollable. And people will try to avoid thinking about those memories, but actually the more you avoid thinking about the memories, the more powerful the memories become, and the less control you have over how you feel and what you think during those times. And so what the trauma narrative does is that it is a very structured way to go through those memories so that you're essentially habituating, or your body and your brain are getting used to them so that it doesn't feel as bad. And so you feel like you have a little bit more control. And so the analogy that I use to talk about the narrative is kind of like when you are just going for a swim. I know that in Florida, most of your pools are heated, but where I'm from, the pools are not heated. And if you first stick your toe in the water, it's going to be really cold and it's going to feel like a shock to your system, right? But the more you kind of slowly inch your way in and your body gets used to the temperature, it doesn't feel as bad. Right? And so the trauma narrative is kind of like that. We're helping kids have a structure for slowly dipping their toe back into those memories with our support. That way, their bodies can start to get used to the feelings, and then they can start to use some of the other skills that are going to help them think differently and feel better in that moment.
Yeah, absolutely. It sounds like a desensitization almost of like slowly going through that. And kind of being in a mindful state as well, and recognizing how the body is responding to that. There could probably be feelings of heightened arousal. There could be a faster heart rate, kind of things like that. And then using those specific concrete skills to help them walk through that. JoEllen, is there something you wanted to jump in on?
Absolutely. I wanted to also add, I think the model is really special because it involves caregivers. And traditionally at our agency and our approach, we've always wanted the family to heal, but we've done that through individual counseling approaches. And in my career as a social worker in New York City for youth and foster care, dependency care, things of that nature, we always worked with systems and families and caregivers, whether they're biological or foster or professional parents, whatever it may be. And although TF-CBT wasn't defined then, because I believe it's like mid 2000s that kind of was developed and named, I really think back to when I was a young social worker back in the day. And I feel like a lot of this is what I did then. It wasn't defined as that. Maybe I've just thought of it as CBT only, or, structural family therapy or a systems approach, but really you're involving a collaborative partner or partners in the healing of that child or that teenager. And so that's why I was so excited about making sure our team at VSC gets the opportunity to be trained, because this approach is powerful. Many rape crisis centers do not start serving individuals until age 18. We start at 12, and rape crisis is not all that we do. So about 25% of our caseload at VSC is between age 12 and 17 years old. And those individuals do not come here by themselves. They come here with someone, and they come to our therapy or our counseling sessions with an individual in their life, hopefully a non-offending caregiver or a support. And so why not let those people who are going to be with them through their journey be educated, aware, and be more able to assist that young person through the lifetime of healing. So that's very attractive to me. And I think it's going to have huge benefits for our community.
Yeah, absolutely. And, I think that caregiver piece that you're highlighting is that, if I'm specifically thinking about kids who have experienced sexual abuse or assault, they are more likely to develop post-traumatic stress disorder because of that interpersonal nature of it. And they're more likely to have been most likely to have been victimized by an adult that they know. right? And so it is so violating on so many levels, and then which can lend to mistrust of the people around them. And part of what I love about TF-CBT that you're talking about, JoEllen, is that caregiver involvement, because in many ways, we're also helping heal a relationship with that for a non-offending caregiver, where they're able to be that supportive person and help a child redevelop trust in a family system. And
Absolutely.
Also, for many of these families too, like, it is, how traumatizing is it for a parent to have had a child who has been assaulted like that or abused like that?
Absolutely. Everyone is impacted by the events. And we've learned, before we even started TF-CBT, we've learned a lot about our parents who do take their children, or even siblings who bring their family members, that there is intergenerational trauma, there's trauma amongst others. And this opportunity to kind of allow a caregiver and a young adult child to engage in conversation, that could change the dynamic when that child grows and how they raise their own children. I think it is so powerful. And then the adult in the picture is going to kind of see, wait, if this works with this child, it can work with me potentially. And let me take a risk. Let me do the counseling for my own needs, because a lot of the times there's a lot of secrets that get kept. Mm-hmm. And there's opportunity through the child's healing for adults to heal as well.
Yeah, it is an incredibly, I think that word, healing process for those families, and empowering. Like, I keep coming back to this idea of, we are helping the child feel empowered so that they have some control in their lives. But many of these caregivers also need that too. Like, they need to feel empowered. They need to feel like they have some control in helping support their child in healing and helping support themselves in healing. And I think that TF-CBT really nicely lays the groundwork for that.
That's incredible. I think that empowerment is always really integral for survivors of trauma. And I think particularly for adolescents, because there's so much that they cannot control or do not have control over in their lives, right? And so I think that this can really help and benefit that. And then also you referencing the building or this building of this relationship with an adult. Adults, when we're children, are supposed to be safe people, right? And so safety is so integral when it comes to healing as well. So yeah, I can totally see how TF-CBT really helps foster that healing and that growth, and how important that can be for survivors of trauma. And speaking of which, JoEllen, you brought up this idea of like a systems and also partners and the community kind of coming together to host this kind of way of communal healing, really. So in that spirit, can you tell me a little bit about the Orange County Learning Collaborative?
Absolutely. I am very proud that Victim Service Center, when it was created back in the late 90s, it was a part of Orange County government, and it is now a nonprofit. It turned into that quickly after, but we've always been very associated with Orange County government, and Orange County is a powerful community. We've been through a lot as a community, with Pulse as a tragedy, with the expansion of the population, having such a high tourist industry. It's a unique place to be. Orange County government reached out to many agencies, and there are currently 8 that are involved in this learning collaborative, and they are really footing the bill to ensure that providers locally are trained on good evidence-based practices that will have lasting impact on the citizens of Orange County. And I think it's a smart, very much sustainable opportunity that we are very fortunate to be a part of. And I'm really excited about it. And I can tell you that not only is it going to change VSC and the professionals at VSC, it's going to change the lives of the clients we meet. And it's also going to change future lives, because we've made so many wonderful connections through this learning collaborative, and we're able to refer clients to the other 7 agencies if necessary, so there's optimal healing for their family's needs.
For us, it's been such a wonderful opportunity to engage the entire community around it. Multiple agencies that serve, different pockets of the community. And I think the most exciting thing for us is to think about the ways that a learning collaborative like this, in bringing people together, is helping create or enhance the system and those connections. So you're able to refer families to each other. You're able to bounce ideas off of each other, able to advocate together for lasting change, right? And doing that together as a group is way more powerful than one individual agency going, to the government and saying, we need this, right? A whole group of agencies that serve a huge proportion of the families in the county can band together and say, this is what we need. This is what we want to do to serve our community.
And how powerful is it that the community is aware and understands that we're not just going to use some anecdotal feelings like, I think people are better. We're going to use evidence-based practices. It's going to be very regimented. We're going to see the success, and we're going to know that the resources that were invested really are going to pay off multiple fold. So I think it's a great opportunity for this community and those impacted and working within the community.
And every community is different too, right? JoEllen, you were mentioning how, unique Orlando is in general and Orange County is, right? And I think that empowering community partners who know the community, who serve the community is a great approach as well. So that's awesome. I'm really happy to hear about this awesome learning collaborative. I know that we were talking a little bit about how TF-CBT is a little different than CBT. So with that, are there other kinds of key aspects of it that you wanted to highlight, what the intervention kind of looks like, and basically the practice and process of TF-CBT?
Absolutely. So just a little background, TF-CBT has been one of the most well-established evidence-based treatments out there for kind of kids' mental health challenges. It's been going on for over 20 years at this point, and there are over 20 highly controlled research trials that support how well it actually works. And we use this acronym in TF-CBT to talk through the different steps or components of the actual treatment itself. So the acronym itself is practice. And so I can walk you through that. The first P stands for psychoeducation. I think with any mental health treatment, it is so important to give a little bit of an orientation to the kids and families who are going to be going through it, so they know what to expect. And also, a lot of people don't know as much about mental health issues as they might about medical issues, for example. And so to tell someone, you went through a traumatic event, the symptoms that you're experiencing right now are actually pretty normal for people who have gone through trauma. Now, the reason why you're here is probably because the symptoms haven't necessarily faded away or gone away by themselves, but they're still with you, months, years later, right? And so really getting in the way of a lot of the things that you care about and find joy in and you live your life for. So giving that kind of psychoeducation about here's what trauma is, here's what it can do to people, here's how it can impact you, can be extremely normalizing and validating for people to hear, I'm not alone in this. I'm not the only one who's had this challenge before. So we always start with that psychoeducation. Another component very early on that kind of shares the P is around parenting. So there is a huge number of kids who have post-traumatic stress disorder who also have some kind of other challenging behaviors, because it's really hard to regulate their emotions. So they might act out, they might have trouble following directions, they might have really intense tantrums because of what they went through with the trauma. And so we want to also equip parents and caregivers to be able to help manage those behaviors in a way that is not traumatizing in and of itself, and in a way that can help also the child feel more in control of their emotions. So there's that, the double P at the very beginning. The next step, R, is for relaxation. We know that with a lot of post-traumatic stress disorders that there is a lot of body tension that goes along with it. There's a lot of trouble that people might have sleeping. And so the relaxation skills are ways to calm both the body and the mind so that, again, we're giving back some control. The next letter is A for affective modulation. Basically, emotion coping. What do you need to do? What are some skills for you to help manage your mood, help you feel a little bit better in those hard times? Whether it's exercising, because exercise is a great mood booster, whether it's doing some problem solving, whether it is doing some fun stuff with someone that you like those are all different ways that you can manage your mood. After we get the affective component done, we talk about C, which is cognitive, and that's basically referring to how we think impacts how we feel and what we do. And so are there ways that we can think that are more helpful, more adaptive? A lot of people know this as cognitive restructuring or cognitive reframing. Yeah. And so those early skills, we call it the prac components, are basically the setup to help kids and families get to a really, a much more regulated place before we go into the most painful portion of addressing the trauma memories.
And I want to add, and I'm looking forward to hearing you, Dr. Kim, talk more about the latter half. But I think it's important to recognize a lot of the times at VSC, when we have, whether they're children, adults, teenagers, they come in, the psychoeducation part, as Dr. Kim mentioned, is extremely empowering for them, because learning calming reactions, being validated, sometimes that is all we ever get to in crisis counseling, because not everyone who walks in the door is ready at this stage in their life to go through the entire journey of healing. But it is amazing to be able to educate people to say, this is what happened to you, this is normal, and it's okay. And I take comfort in knowing if we can at least just get to the psychoeducation, gosh, we have given individuals so much just for that. But I love that this is a committed process and that there is a longevity into the intervention. And I know the second half of it is really after all the rapport has been built and there's a level of trust and comfort between the client and the practitioner. That's really where the deep dive occurs. I can't wait to hear more.
Yeah, so for the second half of that treatment, the TICE, I already talked about how people who have gone through trauma can experience those flashbacks, those memories, the nightmares, right? And we'll try to avoid them or push them away as much as they can, to the point where they're just kind of intruding on them kind of willy-nilly whenever, without their control. And so the T is the basic cornerstone of the whole model. It is the trauma narrative. So that basically we're having children talk out the memory. We're allowing them space to tell the story, to tell their interpretation of what happened. At the early stages of the trauma narrative, it's incredibly painful because they're sharing something that really hurts them. So we do it in a way where we allow them to tell the story. We're not concerned about how accurate it is. This is not for any court case or anything like that. It's just their interpretation of what happened to them and what that means for them. So we start by having them tell that story, right? And we have them retell it over and over and over again so that they're desensitizing to it. Right? And then after they've told that story, they've gotten desensitized, we're able to pull in some of the other skills to help kind of reframe that. A kid might, during the telling of their trauma narrative, their story might say, it was my fault that I got assaulted. I shouldn't have let him touch me, that way. I should have told someone sooner. So there can be a lot of thoughts around blame, for example. And so we might bring in some of our cognitive reframing skills to address that pattern of thinking, right? So they're kind of pulling some of that blame off themselves. We may also, because kids can get so dysregulated while telling their stories, we may also pull in the relaxation strategies so they can use that to calm themselves before they go back into it, before they, have to tell it again. They can pull in some of those other affective, those mood management skills. So all of that stuff is really, the early stuff is leading into a narrative where over time, they are able to control how they're telling it. They're able to control how they're making meaning of it and how they feel in the process. So that's the trauma narrative.
It's so powerful to think how, whether it's verbalized or written, I know it's traditionally verbalized in this approach, but how saying words and repeating the situation can really just provide that venting, that idea of venting, but like in the most cathartic way, if you will. And I know we have more stages of it, but I'm curious, and maybe if it's okay, Emilie, if I ask a question, because I'm not a clinician in TF-CBT, I'm just a senior leader, and we're doing this model. But I wonder, is there any considerations for people who are, who don't have any, developmentally can't verbalize their feelings? Is that considered prior to them engaging in this model?
It is absolutely okay. So the model actually has been tested with children as young as 3 years old.
Wow.
Like incredibly young children. And so for kids that young, their kind of reliving of the memories may be coming out more in their play, right? They'll be playing out, acting out these stories.
Absolutely.
And so for, traditionally, I think the standard way it's trained is that you write down your narrative, you verbalize it, you write it down, you reread it, right? For younger kids, it may be acting it out, playing it out. Right? I have another colleague who had a child wrote a song.
Oh, that's amazing. That's great that you can allow people to kind of lean into what is comfortable for them in that moment. Because trauma narratives are used outside of this intervention or this evidence-based approach. It's used in a lot of trauma-related interventions. So it's clearly strong, powerful, and effective.
Yeah. And even if you don't, even for kids who may not necessarily have a full grasp of their thought patterns or a full grasp of feelings around it, still going through that narrative in whatever form they choose still does have that effect of desensitizing them to it, giving them some control over it. Clinicians do have to be considerate of that. They may have to structure it a little bit more, go a little bit more slowly, but it's still incredibly beneficial regardless of the child's developmental level.
Wow, that's incredible hearing that even 3-year-old clients have actually benefited from it. And while you're speaking on, the trauma narrative, I wanted a question kind of popped into my head that a lot of times when it comes to trauma, a common reaction is, fragmented memory or memory loss. How can trauma narratives help those who may have difficulty remembering what happened to them? Or is this not a good approach for them then?
Honestly, it's not, again, this is not, the trauma narrative is not supposed to be an exact factual recounting of what happened. Right. And so, sometimes we get requests from court saying, hey, can we use the trauma narrative as testimony? And we say, no, because this is based off the child's interpretation of what happened. And so for people who have some memory loss or fragmented memories, we just go with whatever they have. Right. And so give them the space to share whatever it is they remember about it.
One of the eligibility criteria in terms of engaging in this intervention is that there has to be some memory of it and ability to talk about it. But it's never been, you have to know all the ins and outs of the memory. And so having some memory is enough. And I'm really happy to hear that, no, you're not sharing this with the court. I think that is super helpful. And it makes me have comfort in the clinical process, because really that's what it's about, is the clinical healing rather than the justice side of healing.
Yeah, exactly. I mean, ideally there is, both aspects of it, but my expertise is in the clinical realm, and I want to do my best to support the child in that way. And I have to trust that folks on the justice side are doing the same thing, where they're sticking with what they know and what they can do to help. And ideally we're coordinating together in helping a kid in that way.
So after the trauma narrative, which could take some time to kind of like sessions to get through, is the rest of the model kind of very regimented in order? Because I know you can go back and forth between some of the stages of the model. I'd be curious to know what's next, because that narrative is pretty powerful.
Yeah. So if we're going along with our practice acronym, the I stands for in vivo. Now, some people may not need to use the in vivo, and some people may. So, for example, we tell this story sometimes in training of a child who was sexually assaulted, and the trauma narrative is definitely used for, the memories specifically. But actually what had happened was that someone next door was mowing their lawn at the time that this child was being assaulted. And so the smell of fresh cut grass, the sounds of a lawnmower would then trigger a lot of really hard feelings, really negative thoughts, and some of the memories again. And so she would avoid going outside to, wet during the summer months because of all the people mowing their lawns. And so it's incredibly restrictive if that's what's happening. And so the in vivo portion is intended to help her face that fear, face those triggers in, again, that supported way, so that she's not paralyzed in that moment when she hears that lawnmower starting up.
That's a great story. It really is telling. It's so powerful. We've heard a lot from clients about things like smells or a song or a sign on a highway when you drive, like things that senses are so amazingly strong and amazingly powerful. And being aware of what memories come from different sensory, senses is really strong. And it's a great component of this intervention. And I'm really glad that it gets the time that's needed, especially for young people who are going to face those smells, those sights, those sounds in the future.
Absolutely. And I think the next one would be C and E. So if you could just tell us what that would be, Dr. Kim.
Yeah. So the C stands for conjoint, which means this is the part where the child is basically sharing their narrative, their story with a caring adult. Ideally, it's their primary caregiver, a parent that they're able to share this with. Now, I mentioned earlier that a lot of relationships suffer as a result of trauma. And so this is an opportunity for the child to channel their best brave self and share that painful memory with a caregiver in a supportive environment so that the caregiver can validate the feelings and the thoughts that this child has about the actual trauma. Now, the conjoint session or sessions really are the culmination of the narrative piece, but we want to make sure that caregivers are prepared to hear the narrative. So from starting all the way back from the very beginning, we are also doing the psychoeducation, telling them about trauma and the impact, getting a sense of where they are in their journey with healing from the very beginning, from the psychoeducation piece, and then through the process of learning the other relaxation skills, the coping skills, the cognitive skills, we encourage the child to be sharing and teaching the parent or caregiver these skills. And there's that secondary benefit that the caregiver also learns them and is able to use them to manage their own challenges, right? And so we kind of set them up that way. And then the sessions where we're actually building and developing out that trauma narrative with the child, with the child's permission, we are also sharing the sections independently, individually with the caregiver without the child there. So that by the time the caregiver has that last conjoined session and is fully able to kind of sit through the narrative that the child is telling them, they've already heard it before. None of it is a surprise. And they're really able to not focus on kind of the horrific details of the trauma, but rather focus on validating and supporting their child. So, we want to make sure that the caregiver is really ready. And sometimes it's not the primary guardian, and that, maybe mom or dad isn't ready. Maybe it's grandma, maybe it's just some other meaningful person, adult, who really can be that supportive responder to them.
And how cool is it to think that maybe a child can identify someone in their life that even their caregivers didn't even realize was important enough to them. And now that adult may be associated with this child's healing and really kind of invest in that child a little further. So it could, a coach, a teacher, it could have a remarkable impact on future relationships and just developing interpersonally.
Absolutely. Yeah. Kids, as people, even we live in a network of relationships. So we need to have or be able to develop some really strong, healthy relationships, regardless of whether or not you have trauma in your background.
So then let's see, what's that E? What's the final step of this?
The final step is for enhancing safety. So unfortunately, what we do know is that people who have experienced trauma are more likely to experience trauma again in their future. And so we want to be able to make some plans so that should future situations arise, kids and their families are able to prevent it if possible or catch it early. Now, the enhancing safety is something that, yes, technically it's at the end, but we are making sure that we're checking in through the process to make sure that the child is in a safe spot regardless, right? Because,
so is it like safety planning?
Yeah, it's basically safety planning, but at this stage, it's like safety planning for the future.
So like identifying alternative activities
Yes.
when you're faced with certain things. Excellent.
Absolutely.
Makes a lot of sense.
That's awesome. Thank you so much for breaking that down so beautifully. I think that we're hearing a lot of different amazing things. I had a question about the caregiver as far as as they're going through it so that they're prepared for it, but you answered that really well as well. And you mentioned that the trauma narrative can take a while as well. So how long typically is this intervention?
from the research, it can be as short as 8 sessions. Some people, depending on the type of trauma, depending on their level of insight, can, really speed through it. It can go up to 25 sessions or longer. The research shows generally we're in that 8 to 25 range. I'm guessing like the 15 to 20 is probably more the actual range that we see. So it's actually incredibly time limited. Just because someone has had a traumatic event happen to them doesn't mean they need to be in therapy forever, right? There's no shame if they do feel like they want therapy, ongoing, but they can really have a big dent on that, make a big dent on that healing process just in those, 15 to 20 sessions.
Wow.
That's probably amazing buy-in as well for families to be able to kind of say, I can invest those many months. This seems like I could probably do this in 6 months' time. That's very much palatable and doable for a family system to be involved. So that's one of the other great points of this intervention is it's, we do have people that are with us that are adults that have faced childhood issues that are in therapy with us for a significant amount of time. And we have to have some limits to that, which is traditionally about 12 months or so. But this is even more, I don't want to say speedy, but it could be more efficient, which is great. When you have a child and they have so many other life demands and attention to this process, we don't want to live our lives around our trauma. We want to navigate our trauma so we can live our lives.
And you mentioned earlier, we talked a lot about the trauma narrative, and I wonder, is there any kind of other school of thought as far as, any kind of criticism to actually having to talk about your trauma specifically? And I don't know what you would say to anyone who may have different thoughts about how beneficial that is.
Yeah, the most common misperception about having someone tell their trauma is that you're going to re-traumatize a child, right? And as a clinician and as a human being, I don't want to be the one responsible for causing pain. Because especially as a therapist, my job is to help and support in healing, right? And so the analogy that I often think through and that we often talk through with other therapists is that of I may fall and get a cut, and that hurts. That's painful. I'm not going to deny that. And for some instances, that cut on its own is going to heal, right? I think of trauma that way, where we go through this painful experience and they demonstrate resilience. Sometimes though, that cut, if you do leave it, it can get infected. And so we don't want that infection to grow and then impact the rest of our bodies. Right? We don't want the trauma to grow and impact the rest of our lives. And so for a cut, normally we would clean it out, right? Use some soap, use some water, clean out that cut, maybe use a little hydrogen peroxide if it's an extra nasty one. And that stings. I have a 3-year-old, if he gets a cut and I make him wash his cut out with soap and water, he's screaming and shrieking and getting mad at me about it. But as a mom, I know that I have to do that, right, to keep it from getting worse. And so a trauma narrative, having them retell their story is in essence helping them clean out that wound so that it's not, getting worse, festering, infecting the rest of their lives.
You're absolutely right. It's I love that analogy. We use a similar one with our crisis counseling versus therapy. And, it's almost, if I was to give that a little keyword, I would say tough love in a way. We need as parents and clinicians to kind of push a little bit, because that push can really be powerful. It's not intended to hurt. And we're going to maybe feel some ways about seeing a young person have to do it, but the growth, it's going to have a huge trajectory of growth and healing. So that's when you see it, is afterwards you realize it was worth that adversity. It was worth sharing and it was all for a therapeutic benefit.
Absolutely. And afterwards, we're not saying that the trauma didn't happen. We're not getting the child or the family to deny its existence and just forget about it. Just like with a cut, the scar may remain. You still may have some pain around it. It may not be exact. Your memories might not be exactly as they were before. Your life will not be exactly as it was before. And we're helping and supporting people so that they can continue to live and that they can continue to find meaning or re-find meaning and purpose in their lives, and start to rebuild.
And what I would say, and if I could, I really think that sometimes we treat adults and we see adults that they've been traumatized. They have not had these wonderful opportunities or interventions, and they unfortunately have gone down roads of depression or substance and alcohol use, maybe cutting, things like that. And who's to say? I'm not sure. I can't say that this could avoid that, but it certainly is possible that working through it and doing the hard work with the trauma narrative at a young age post the event could change that life journey and that life path in some way to avoid some of those really negative outcomes that we often see in adults.
Absolutely. And I wanted to ask too, we were talking about how it can be, working with trauma can be a destabilizing process. So what are signs that a child is ready for TF-CBT?
I don't really think about it so much as whether or not the child is ready for TF-CBT. I think that regardless, a child and a family will benefit from having some form of coping skills. And so especially those early phases of treatment around the psychoeducation, the relaxation, the affective mood management pieces, and the cognitive coping, I think those are useful for anybody. Like everybody can benefit from that. And so I think that like those pieces, you can kind of get started whenever. And I think it's more as a therapist about getting kids and families to buy into actually using them. I think the hard part is the trauma narrative, and I think the major situations where we would not push on the trauma narrative are if we know that the child is actually not in a safe situation, if it's violence perpetrated by another person, if they're still in close communication with that person and that person is not in an unsupported way. So that may be an instance where, we may pause because we do not want to put the child further at risk. But otherwise, it's like good barbecue. You start really low and really slow. Like you take the time. And so you could do a trauma narrative in a really, really small way. And, actually just by talking about and mentioning the word trauma and doing the psychoeducation, you're doing a little bit of the hard work of exposing them gradually to the eventual hard topic of their own trauma. So I think that it's more about the process of getting someone ready and being sensitive about the speed and the pacing rather than saying they are or not ready in the moment.
It does seem like by design that it is giving people the tools to have the ability to process it. So it makes sense. JoEllen?
I will say for the learning collaborative component of this all, there's definitely things that we're thinking about when we encounter a new or potential client who's had a history of trauma. And so we're going to consider their age. Although this intervention can be used for persons who are beyond the age of 18, for this learning collaborative, those between 12 and 17 are going to be a part of kind of our reporting and looking at their success in this intervention. But we do intend as an agency, if there is, say, a 19 or 20-year-old who does have a trauma, a memory of that trauma, is willing to speak of that trauma and has at least one supportive caregiver, we're going to entertain this approach with them, although it may not count as part of the learning collaborative, but our clinicians are trained in it and we're confident in the intervention and the impact it will have on their lives.
And, for the families who have kids younger than 12, part of the beauty of the Learning Collaborative is that VSC now has partner organizations in the community who serve younger kids.
Yes, and it has already panned out and worked out with referrals, because sibling groups could be large and we can't serve those under the age of 12. So this has been wonderfully beneficial.
And speaking of beneficial, I with the few minutes that we have left with each other, I'd like to ask if you have any kind of case studies that can show, the benefits of this particular intervention and therapy.
Yeah. So I worked with a child a few years ago now. He was 9 years old and had witnessed some pretty significant domestic violence between his parents from a very young age, 9 years old, and already having a lot of this exposure. So when I started working with the family, I said, hey, I know this model. It's got really great results. Let's try it. And this mom and the child had basically relocated across the country to give some separation between them and the father. And so as we were starting, I was trying to start with, all those psychoeducation, doing all of the other kind of emotion coping skills. And really what I was finding at the time was this kid was getting so dysregulated that he was getting in trouble at school. He was, having a really hard time at home. Mom, as a single parent now, was having a hard time just managing all of his behaviors. So they would just have these arguments about any time she needed to have him do anything at home. And she was just at her wit's end, and also suffering from her own PTSD, which made it even harder. And so, we really took some time early on to help build up her self-efficacy as a parent, giving her some really solid parenting skills to help manage the challenging behaviors, the tantrums, and things like that. And as she was doing all of those skills, a big component is positive reinforcement. So she was able to help build up her son so that he was starting to feel better about himself and starting to feel good anytime he was following through on the things that she was needing him to do. So with that, we started to see a little bit of that shift in his presentation and his mood. He was just starting to be a happier kid. They were starting to have a healthier relationship. And then we dove into those other skills again, the relaxation, the mood management. And he was able to learn those skills and then go into that trauma narrative where he was telling the stories of all the different times that he witnessed violence, and talk through it in a really supportive way. And by the end, he goes to me, do we have to keep doing this? I'm so bored of telling my story. And to me, the idea that he could get bored of it, it was just, he's gotten so used to telling it that he would rather be doing other things.
Wow, that's very powerful, because it's he's taking control.
Exactly. And so I said, if you're bored, yeah, that means we're pretty much done. And so for his mom then, in being able to share with her his story, and just, she had never heard him tell it from his perspective. She knew he had been scared. She knew how awful it was, but not to the level that he was sharing with her. And, she was really able to, even though she was still struggling with her own PTSD, working through her own therapy for it, she was able to be there in that moment with him, and, hug him and tell him how proud she was that he was brave and being able to tell his story. And so by the end, they were mom's I still have my own work to do. I feel really inspired and motivated by what you have done, what you, my son, have done, how brave you've been, to the point where I want to do that for me. And she leaned in even more to her own treatment. And kids doing much better at school. He's at camp, things are going well. He's talking about doing all these different sports and different activities. He's making friends in a new place, and just getting along so much better with his mom. So it was just such a powerful experience. I feel like I learned more from them about healing than I did, than the work that I did for them. I think I benefited way more.
Wow.
Just by having that experience of them being willing to go through the journey and, share that with me.
Isn't it lovely as a clinician when you really look at a client's progress and realize they've changed me for the better in a way? It's lovely.
Yeah, I think we talk a lot about vicarious trauma in the work in this realm. And through the many different podcasts that I've done, people have brought up a term that I really identify with, which is vicarious healing. So that is also a really important piece to this too, where we saw that even with, the guardian and the caretaker, but also the clinician, such as yourself. I am very moved to hear the impact that it had on you. So thank you so much for sharing that, Rachel. I really appreciate it. We only have a couple minutes left. So if someone would like to learn more about TF-CBT, where can they go?
The easiest place is TFCBT.org. That's TFCBT's own website. It's perfect. It's got some information on there. The other great resource, both for therapists and families themselves, is the National Child Traumatic Stress Network. Their website is nctsn.org. They have a ton of resources on there about different types of trauma, different approaches to treating trauma. And I think for most people, what's been most helpful is they just have these fact sheets and tips for families, educators about what to do when a child has gone through trauma. So I particularly love that resource. They're also really welcome to reach out to us at the Baker Center. We're always happy to support families in, we're in the Boston area. So if families are in the Boston area, they're welcome to come to us. We provide the therapy ourselves, but we also do a lot of work nationally, training and supporting organizations who are doing the work. So they can reach out, check out our website, which is bakercenter.org. And they can reach out directly to our team at training@jbcc.harvard.edu. And we're happy to support families, professionals in whatever way we can.
If individuals are local to the Central Florida area, they can reach a victim service center. And we do referrals if necessary, or if people are not in our area. So we can always connect individuals. We get a lot of people that reach our website from other parts of the country. So we'd be happy to connect individuals that way as well.
Thank you so much for all of the incredible work that you do, Dr. Kim. We've learned a lot just through this podcast alone, and I'll be sure to add those different emails as well as links that you mentioned into the description here for this episode. I think that that's a great place to sign off. But before we do, is there anything you would like to bring up that we may not have mentioned, or any kind of final thoughts?
I think just generally speaking, it is, for me, I think that the more we can provide information to families, the better, so that they can make a really good informed choice about their options in getting support. So I've just been so grateful for the opportunity to share this with you all, and really appreciate the invitation, and hope that, with the good work that you all are doing at Victim Service Center, and, in collaboration with Orange County, in collaboration with the other agencies in this initiative, I feel really hopeful for the families in Orange County who are able to get this awesome approach.
And I just want to say a huge thank you, Dr. Kim. I don't know if it's possible, but maybe at the end of this collaborative, we can have a podcast and talk about some of the success stories that happened with us and what we saw for clients, because I am confident that we're going to see some positive things that come out of this learning collaborative and the work with the Judge Baker Center. So thank you so much for your expertise in this work. I really appreciate it. And it was a lovely conversation today.
It really was. Thank you so much. And thank you to the listener for listening to the Victim Service Center podcast. The VSC is a nonprofit organization that provides free, confidential counseling services for victims of any kind of trauma in Central Florida. To learn more about our services, please visit victimservicecenter.org. And to everyone listening, healing is not linear and you are not alone. And thank you so much, JoEllen and Dr. Kim, for being here today.
Bye.
Bye, everyone.